Vaseline, acidic material, alkaline. If the oral mucosa is kind of sloughing off in the mouth, they've sustained severe burns of the airway, facial deformities and such. So you go through those contraindications, and if none present, then you're going to say, okay, I'm going to go ahead and consider the supraglottic airway. To consider it, I'm going to have to step aside and set up the eye gel, but while that's being done, the patient needs to continue to be ventilated, and I have to pre-oxygenate. So you either tell your partner, like, hey, can you connect add nasal cannula to the patient right now? So you move the bag, your partner brings and attaches the nasal cannula. Just so you know, these mannequins' ears are not perfect, so don't worry about too much, like this has to be perfectly attached, right? So your partner does that, and while you're ventilating, and then once that's in place, connected to a second oxygen source, you are going to step aside and your partner will take over ventilation. Or you tell your partner, can you please take over ventilations? So you move aside, your partner's ventilating, you attach the nasal cannula, and then you go on to put together the eye gel. So for the sake of it, we'll say I have a second person who is ventilating one every 6 seconds, and I'm gonna go ahead and set up my eye gel. This is the strap that's eventually gonna go underneath the head, and like this, it's gonna come around, not around the neck. Okay, so it has to be under the skull, the occipital area. So I can pre-position this by sliding on the gap underneath the neck and let it sit there. Then I'm gonna grab, so the lubricating jelly will be this size packet. I'm using this because we're gonna keep using multiple ones today. So I'm gonna take the eye gel out of its cradle, holding the cradle in my hand, put the eye gel next to it. There's a little indentation in that cradle, a little circle. Just about that size, I'm gonna put a little bit of a water-soluble lubricate jelly. And you wanna lubricate the side, the back really well, and the other side. What you don't want to lubricate is inside where it's going to go against the airway, right? So the back of it, lubricate it well. And then I'm going to ask my partner, hopefully at this time it's been like about a minute and a half or 2 minutes. I'm going to ask him like, okay, go ahead and remove the OPA and step aside. So my partner will move to the side, remove the OPA straight out. I will reposition myself behind the patient's head. I'm going to remove the eye gel from its cradle. Patient's head has to be in what position? What did the video say? Just remember? Say, sniffing in the morning air. Now, sniffing the morning air is only valid if there's no trauma, right? So if there's no trauma, literally you guys are going to bring the patient's head up like that, and then you will see the palate, the hard palate, the roof of the mouth. I'm going to move the chin forward a little bit, grabbing the top. I'm going to guide the tip of it towards touching the roof of the mouth, and I'm just going to slide it in. Okay? Once I made definitive resistance, that's when I stop. And then ideally the teeth should be on the bite block. Once it's there, I'm going to go ahead and confirm 3 ways that this is properly placed. So you have your stethoscope on, right? My partner is going to connect the bag valve mask here. So the first thing I'm going to do, I'm going to ventilate. I'm going to squeeze. I should see breaths fall. That's number 1. Then I'm going to have my partner hold on to the bag. I have stethoscopes on. So I'm going to have the stethoscope on. Obviously use yours because you're going to put it in your ears. I'm going to come down here. I'm going to ask my partner to squeeze. My partner will squeeze. I'm going to move on to either left or right, wherever I started. The opposite side squeeze, and then I'll go to the epigastric, about the belly squeeze. So what I'm trying to listen is clear lung sounds, or lung sounds I should say, air movement, and no air movement going to the belly. So absent epigastric, present lung sounds. That's my second confirmation. And for the third confirmation, I need the colorimetric device that we kind of mentioned on Thursday. This, your partner can initially connect it and pre-set it up for you while you're inserting the eye gel. So when they connect it, then you're gonna squeeze, and this color should change. What color to be good?
Purple.
Huh? Pink, purple.
There's yellow and purple. I forget which one's good.
Well, if your skin signs look purple, is that good or bad?
Bad.
Bad. So purple is not good. Right? So if you turn purple, that's not good. So you want to be yellow. Yellow means acidic, right? So that paper should be yellow once you ventilate. It doesn't turn yellow with one ventilation. So it takes about maybe 6. So that's why if you pre-connect it while you're listening to lung sounds, absent epigastric sounds, and looking for chest rise and fall, you've already ventilated at least 4 times. So by that time, you can turn around and see this is yellow, golden. Then you're gonna say, okay, your partner's ventilating. You're gonna go ahead and secure the tube. You're gonna shimmy it underneath the head, bring it up, drop it in that little prongs that are sticking out, and you're gonna reassess, reevaluate. Your proctor says, oh, there's vomit coming out of the gastric channel. Then you're gonna go ahead and pull the suction, connect it to the tubing end. You're gonna remove the hard one out, and then you're gonna insert and suction. If vomit is coming out of the actual oxygenation or the port where you're ventilating, you can use the rigid one to suction. If your patient starts breathing on their own, they still do not have gag reflex, but it's adequate rise and fall, so no longer this is needed to ventilate. You can undo this little port, expose it, and then you can connect simply oxygen. Connect here, connect to oxygen tubing, and then so it provides supplemental oxygen while your patient breathes. If they have a gag reflex, remove, gently pull it up. Questions?
What happens when they have a gag reflex in the team? Do they just